How can you tell if your peacock has a respiratory infection? That's a question that can stump even the most seasoned peafowl owners. Unraveling this mystery isn't as difficult as it might seem. In fact, with some basic knowledge and careful observation, you also can become adept at identifying the telltale signs of a respiratory infection in your peacock. First, it's important to understand what a respiratory infection in peacocks typically looks like. The most common symptoms include a runny or congested nose, watery eyes, sneezing, coughing, and difficulty breathing, gasping for air, sometimes swollen sinuses. If your peacock exhibits any of these signs, there's a good chance it could be dealing with a respiratory infection. Listen to your peacock's breathing. Is it labored or noisy? This could indicate a blockage in the airways, a common sign of respiratory infection. Also, pay close attention to your peacock's behavior. Is it less active than usual? Is it eating less or not at all? These could be signs that your peacock is not feeling well and could be suffering from a respiratory infection. Checking the peacock's weight is another key step in diagnosing a respiratory infection. A sudden drop in weight can be a clear indication that something is amiss. But what should you do if you suspect your peacock has a respiratory infection? The first step is always to consult with a veterinarian who specializes in birds. They can conduct a thorough examination and provide appropriate treatment. But what if you don't have access to veterinary care? While it's always best to seek professional help, there are some steps you can take to help your peacock recover at home. For peafowl over 4 months of age, provide a poultry cell vitamin formula rich in vitamin A and antioxidants can boost the peacock's immune system and help fight off the infection. We recommend and use broad-spectrum antibiotics such as Tilin 200 or oxytetracycline or enrofloxacin, provided orally to treat respiratory. Baby peacocks under 4 months old should remain on medicated feed with antibiotics orally dosed. Do not add additional vitamins to Peacocks at this age while on medicated feed. If you choose to provide additional vitamins, you must then move them to a non-medicated feed. We do not recommend non-medicated, however, to Peacocks under 4 months of age. Antibiotics treatment is the most important action with respiratory infections for any age of peafowl. Keep the bird's environment clean and dry. Moisture and dirt can exacerbate respiratory infections, so it's important to keep the peacock's living area as clean as possible. Keep the peafowl warm. At any age, a sick peacock will have difficulty maintaining its body temperature, so it's important to provide additional warmth, especially during colder months. Remember, your peacock is depending on you to keep it healthy. Thank you for watching Peacock Passion.